Pakistan will launch a vaccination drive against COVID-19 in April, which will be free for citizens. But in a country with a rampant anti-vaccination campaign, which at times has erupted in violence, it could be a challenge to administer a vaccine to everyone. Maya Leyuto tells us more.
Sabra Khan has been vaccinating children against polio as part of a government campaign since 2003. And in recent years, she's been operating in this neighborhood of Rawalpindi, which is adjacent to Pakistan's capital, Islamabad. Most of the people here have moved from more conservative parts of the country, where distrust about vaccinations runs deep.
हमें बहुत मुश्किलात होती हैं काफ़ी, जैसे कोई रिफ्यूज़ल ख़ानदान अगर हमें मिल जाता है तो वो कहते हैं कि जी हमने पिलाने ही नहीं है, तो अगरचे वो कुछ मजहबी टाइप हो तो वो कहते हैं ये फलां मुल्क के बने, वो यहूदी है, वो ये है, वो है, हमने नहीं पिलाने, चाहे जो मर्जी कर ले.
Pakistan is one of the only two countries in the world which has failed to eradicate polio, partly because of a religious pushback against vaccination. For years, Pakistan has been battling misconceptions and conspiracy theories surrounding polio campaigns, with some hardline religious leaders claiming that the immunization programs are harmful or a cover for foreign interests. That's resulted in threats and violence against vaccinators and police, and even some fatalities. At the same time, the number of unvaccinated children continues to grow. This could have ramifications on the country's anti-COVID-19 drive.
कोरोना का ये कि जो रिफ्यूज़ल है हमारे पोलियो के लिए, मैं भी हो सकता है वो भी कोरोना के लिए भी रिफ्यूज़ हो जाए.
According to a Gallup report in October, 55% of Pakistanis are unsure if the coronavirus is real, and 46% think it's a conspiracy. This, even as the country witnessed a spike in COVID-19 cases and related deaths in recent weeks, following months of relatively low figures.
कोरोना बारा के मुंदावे से कुरान नशे चटी खबर आदासी चटी पाजा बावल के खाल खुसरा ये सब नशे दे खाल कम दखल चटी खबर आदासी सब नशे दाव पाजा बावल जाओ ये सही खबर नशे कोरोना.
Attitudes like these have also affected the recruitment of volunteers for COVID-19 vaccine trials in Pakistan, says Dr. Ijaz A. Khan, a principal researcher for one such trial at Shifa International Hospital.
Misinformation for that disease itself is a big challenge, and that is being faced by us, and we have employed multiple solutions to dispel that misconceptions and misinformation. And this is not unique to Pakistan, it is across the globe.
Experiences made during polio campaigns have already prepared the authorities to deal with vaccine refusals.
There is a strategy in which we have already mapped the high-risk population where the number of refusals are more. For that purpose, we are just focusing on addressing these localities and the vicinity and the sect from which these refusals belong, so that we can convince them.
But even if it succeeds in convincing the public, immunizing the entire population in Pakistan is no easy task. As a developing country, Pakistan lacks the infrastructure to maintain the cold chains needed to transport the COVID-19 vaccine. And time is running out as it prepares to start its COVID-19 vaccination drive in April. Maya Leyuto, CNA, Islamabad.